there, beautiful souls, and welcome back to another episode of Energize Your Passion. That's all about bringing positivity, energy, and empowerment into your lives. I'm your host, Sunshine, and today is a special episode where we're diving into a topic that's incredibly important, but often not talked about enough: medical gaslighting, and the vital need to advocate for yourself or have someone advocate on your behalf. Now, I know what you might be thinking. Sunshine, what is medical gaslighting? Well, let's start with a little background. Medical gaslighting happens when a healthcare professional dismisses or trivializes a patient's symptoms, concerns, or experiences. It's when they make you feel like what you're experiencing isn't real or significant. And let me tell you, it can have serious consequences on your health and well-being. In this episode, we're going to explore what medical gaslighting looks like, how it affects you emotionally and physically, and most importantly, how you can stand up for yourself in these situations. We'll also talk about how to seek support and build a network that can help you navigate these challenges. So grab a cup of tea, get cozy, and let's energize your passion for self-advocacy. Before we dive into the nitty-gritty, let's start with a story. I want to be completely transparent and share one of my own experiences. Yes, one of the many times I was medically gaslit. This happened over 30 years ago when I was pregnant with my first child. I was in the 9th month of my pregnancy, and a sonogram had given us a due date of early January. For the past 30 days prior to the birth of my son, I've been bouncing back and forth between my doctor and the hospital because of pain and what I thought was labor. And when I say thought, I mean I was repeatedly told I was not actually in labor. Sure, maybe some of those visits were false alarms, but what happened next was beyond frustrating. One night, the pain became so unbearable, and I headed to the hospital again. They told me once more that I wasn't in labor. But this time, they added a twist. They claimed my baby wasn't due until March, just because my belly measured small. That was the last straw for me. My partner and I decided to leave that night and head north to visit family and get a second opinion. Within 2 days of being up north, I went to the hospital for a checkup. They admitted me immediately and performed an emergency C-section. Here's the kicker. When the doctor came in to check on me and the baby, he said, "I'm happy you and the baby are doing well because the baby was in distress." The emergency C-section was necessary because, as it turned out, my baby was overdue by almost 3 weeks. Yep, that initial sonogram was spot on with the predicted due date. I shared this story to underline a crucial point. Trust your gut. If something doesn't feel right, don't let anyone dismiss your concerns. Follow your instincts because you know your body better than anyone else, sometimes even the doctor. Segment 2, the emotional and physical impact. All right, let's dive deeper into how medical gaslighting affects us both emotionally and physically. I think it's essential to truly understand the weight of this issue so we can grasp why advocating for ourselves is so important. Imagine this. You've been feeling off for months. There's this persistent pain or nagging symptom that you can't shake. You finally decide to see a doctor, hoping for some relief and answers. But instead of receiving validation and a plan for treatment, you're told something like, it's all in your head, or you're just stressed. Sounds familiar? This is a classic example of a medical gaslighting, and it can be incredibly damaging. Let's start with the emotional toll. Being dismissed by a healthcare professional can make you start to doubt yourself. You might think, maybe I am overreacting, or what if it really is just stress? This self doubt can spiral, leading to feelings of frustration, anxiety, and even depression. The very person you turn to for help has invalidated your experience, and that can feel deeply isolating. You start to question your own reality and may even hesitate to seek medical help in the future for fear of being dismissed again. Let me share another story to illustrate this. I remember a friend of mine, let's call her Terry. Terry had been dealing with severe fatigue and joint pain for years. Every time she visited her doctor, she was told she just needed more rest and that it was all due to her busy lifestyle. Terry began to believe that maybe she was just not managing her stress well. It wasn't until she saw a specialist who took her symptoms seriously that she was diagnosed with an autoimmune disorder. For years, she felt like she was going crazy, but all along, her body was trying to tell her something important. Now, let's talk about the physical consequences. When your symptoms are dismissed, you're often denied the necessary tests and treatments. This can lead to a worsening of your condition. For example, if a chronic illness is not diagnosed early, it can lead to complications that might have been preventable with timely intervention. You might end up suffering longer and more severely than you would have if your concern had been taken seriously from the start. For some, like my own story, it can even become a life threatening situation. Remember my pregnancy story from earlier? If I hadn't trusted my gut and sought a second opinion, my baby and I may not have survived. The hospital dismissal of my symptoms nearly cost us our lives. This cycle of doubt and dismissal creates a vicious loop. The more you gaslit, the less likely you are to seek help. This leads to prolonged suffering and potentially severe health consequences. It's a cycle that must be broken. Another story came to mind of John, a colleague of mine. He experienced serious chest pains, but his doctor attributed it to anxiety and sent him home with some anxiety medication. John, doubting his own perception of pain, took the meds and tried to move on. It wasn't until he had a heart attack weeks later that the true cause of his pain was discovered. His initial symptoms were dismissed, and he paid the price with his health. The emotional and physical impact of medical gaslighting underscores why it's so important to address these issues head on. Your medical health can suffer from constant invalidation, leading to stress, anxiety, and depression. Meanwhile, your physical health can deteriorate without proper medical attention. It's not just about feeling unheard, it's about the real, tangible effects on your health and well being. Understanding the emotional and physical toll of medical gaslighting is the first step towards empowerment. When you recognize that your experiences are valid and that your symptoms deserve attention, you can begin to take steps to advocate for yourself more effectively. Remember, your feelings and experiences are real. Don't let anyone make you feel otherwise. In the next segment, we'll talk about how to recognize the signs of medical gaslighting so you can better prepare to address it when it happens. Knowing these signs is crucial in helping you stand up for your health and well being. By expanding on the emotional and physical impact of medical gaslighting, we highlight the gravity of the issue and why it's crucial to advocate for oneself in healthcare settings. This sets strong foundations for understanding the importance of the subsequent segments focused on recognition and self advocacy, recognizing signs of medical gaslighting. Welcome back, everyone. In the last segment, we talked about emotional and physical impacts of medical gaslighting. Now, let's get into how you can recognize when it's happening to you. Being able to identify the signs of medical gaslighting is the first step in taking back control of your healthcare experience. Medical gaslighting occurs when healthcare professionals dismiss or downplay a patient's symptoms, concerns, or experiences, often making the patient feel like their issues are not real or not serious. This can be subtle or overt, but the key is the undermining of your experience and the failure to provide appropriate care. Here are some red flags to watch out for. Number one, dismissal of symptoms. Example, you go to the doctor with a persistent pain or unusual symptoms, and they say something like, it's nothing to worry about, without conducting any tests or only offering a superficial explanation. The impact, this can make you feel like your concerns are not valid, and you might start doubting yourself. Number two, patronizing language. Example, the doctor might say, you're just being anxious, or it's all in your head. These statements trivialize your experiences and suggest that you are overreacting. The impact, this can lead to feelings of embarrassment, frustration, and self-doubt. Number three, reluctance to investigate further. Example, despite ongoing symptoms, the doctor refused to order further tests or refer you to a specialist. They might say, there's no need for more tests, you're fine. The impact, you might not get the necessary diagnosis or treatment, leading to prolonged suffering or worsening conditions. Number four, blaming the patient. Example, comments like, if you lose weight, you'll feel better, or you're just stressed out, without considering other underlying causes. The impact, this places undue blame on you and ignores other potential medical explanations. Number five, ignoring patient history. Example, the doctor does not take your medical history into account or disregard past symptoms and treatments. They might not even look at your records before making a judgment. The impact, this can lead to a misdiagnosis or inadequate treatment, as the full picture of your health is not being considered. Let me share a story about a friend. Her name is Denise. Denise had been experiencing severe headaches and dizziness for months. Every time she went to her doctor, she was told it was just stress or perhaps a minor migraine. No test was ordered. She was given painkillers and sent home. Denise started to believe that maybe she was just not handling stress well. But the pain persisted, and one day it became unbearable. She decided to see another doctor who immediately ordered a CT scan. It turned out Denise had a small but significant brain aneurysm that needed immediate attention. If she had continued to listen to her first doctor, who dismissed her symptoms, the outcome could have been catastrophic. Number 1, invalidation of feelings. Behavior patterns to watch for. Number 1, invalidation of feelings. Doctors who frequently dismiss your emotional responses to their symptoms can make you feel unheard. Statements like "you're just overreacting" are common. Number 2, oversimplification. When a doctor simplifies your condition to one cause without thoroughly investigation, it's a red flag. For instance, attributing all symptoms to stress without considering other possibilities. Number 3, frequent interruptions. If a doctor constantly interrupts you while you're explaining your symptoms or history, it shows a lack of respect and unwillingness to fully understand your situation. Number 4, lack of follow-up. If your doctor does not schedule a follow-up appointment or check-ins to see how you're doing after initial consultations or treatments, this might indicate a lack of concern for your ongoing health. Recognizing these signs empowers you to take action. If you notice these red flags, it's important to address them directly. You might say, "I understand that you think it's stress, but I feel more comfortable if you would run some tests to rule out other possibilities." It's also okay to seek a second opinion if you feel your concerns aren't being taken seriously. Another example is a close friend, Luke. He had been dealing with persistent back pain that affected his daily activities. His doctor kept telling him it was just due to poor posture and recommended some basic exercises. Luke followed the advice, but the pain only got worse. Frustrated, he visited another doctor who took his symptoms seriously and ordered an MRI. It turned out Luke had a herniated disc that requires specific treatment. The second doctor's thorough approach made all the difference. One practical tip is to keep detailed records of your symptoms, treatments, and interactions with healthcare providers. Document dates, times, and the specific nature of your symptoms. This not only helps you track your health more effectively, but also provide tangible evidence when seeking second opinions or further tests. Ultimately, you know your body better than anyone else. If something feels off, don't let anyone dismiss your concerns. Trust your instincts and advocate for the care you deserve. In the next segment, we'll dive into specific strategies for effective self-advocacy. Remember, recognizing the signs of medical gaslighting is just the beginning. Armed with this knowledge, you can take steps to ensure your voice is heard and your health is prioritized. Stay tuned and let's continue empowering ourselves to take charge of our health and well-being. Segment 4, Strategies for Effective Self-Advocacy. Welcome back, everyone. In this last segment, we'll talk about recognizing the signs of medical gaslighting. Now let's dive into how you can effectively advocate for yourself in healthcare settings. Self-advocacy is crucial for ensuring you receive the care and attention you deserve. Here are some practical strategies to help you stand up for yourself and make your voice heard. Number one, document everything. Keeping detailed records of your symptoms, treatments, and interactions with healthcare providers is one of the most powerful tools you have. Symptoms diary. Start a diary where you note down every symptom you experience, including its intensity, duration, and any potential triggers. Include dates and times to track patterns. Medical records. Keep copies of all medical records, tests, results, and prescriptions. This documentation can provide a comprehensive picture of your health history. Appointment notes. During doctor visits, take notes or ask if you can record the conversation with the doctor's permission. This ensures you don't miss any details and have a record of what was discussed. Let me tell you about my friend Emma. Emma had been experiencing severe fatigue and joint pain for years, but her doctor kept dismissing her concerns. She decided to start a symptom diary, documenting every detail meticulously. Armed with this detailed record, she visited a new specialist who took one look at her comprehensive notes and immediately ordered tests. Emma was eventually diagnosed with an autoimmune disorder that explained all her symptoms. Her detailed documentation was key in getting the proper diagnosis and treatment. Number two, research your symptoms. Knowledge is power, especially when it comes to your health. Educate yourself about your symptoms and potential conditions. Use reputable sources such as medical journals, websites from trusted health organizations, and books by healthcare professionals. Understanding conditions. Learn about possible conditions related to your symptoms. This helps you ask informed questions and engage in meaningful discussions with your doctor. Prepare questions. Before your appointment, prepare a list of questions based on your research. This can include asking about potential diagnosis, tests, treatments, and next steps. Number three, ask questions. Don't be afraid to ask questions and seek clarification. Clarify doubts. If you don't understand something, ask for clarification. For example, can you explain what this test involves? Or what are the potential side effects of this medication? Challenge dismissals. If a doctor dismisses your concerns politely but firmly, ask for further explanation. I understand you think it's stress, but could we explore other possibilities? Explore options. Inquire about alternative treatments or second opinions. Are there other treatment options we can consider? Or would it be beneficial to see a specialist? Number four, bring support. Having someone with you during medical appointments can provide emotional support and ensure your concerns are addressed. Choose a trusted person. Bring a family member, friend, or caregiver who understands your health issues and can advocate for you. Take notes together. They can help take notes, ask questions you might forget, and reinforce your concerns. Emotional support. Having a supportive presence can make you feel more confident and less isolated during the appointment. My coworker Janet was struggling with chronic migraines. Her doctor kept attributing them to stress and prescribed painkillers. Frustrated, Janet brought her husband to her next appointment. He was able to articulate the impact the migraines was having on their daily life and ask pointed questions about alternative treatments. With his support, Janet's doctor finally referred her to a neurologist who diagnosed an underlying condition that was causing the migraines. Having her husband there made all the difference. Number 5, seek second opinions. If you feel your concerns are not being taken seriously, it's perfectly okay to seek a second opinion. Don't feel guilty. Remember, your health is your priority. Seeking a second opinion is a common practice and can provide new insights or confirm a diagnosis. Find a specialist. If necessary, look for specialists who have expertise in the area related to your symptoms. They might offer a different perspective, a more advanced knowledge. Compare notes. Take your medical records and symptom diary to the new doctor. Compare their feedback with your previous experiences to make an informed decision. Number 6, be assertive. Assertive communication is key to effective self-advocacy. It's about expressing your needs and concerns clearly and confidently without being aggressive. 1. Use I statements. Frame your concerns using I statements to focus on your experience. For example, I feel my symptoms are not being fully addressed, or I am worried about my ongoing pain and would like to explore further testing. Stay calm. Even if you're frustrated, try to remain calm and composed. This helps in maintaining a productive dialogue and ensures your concerns are taken seriously. Repeat if necessary. If you feel like you're not being heard, don't hesitate. Repeat your concerns. Persistence can sometimes be necessary to get the attention you need. By documenting your symptoms, researching your conditions, asking questions, bringing support, seeking second opinions, and being assertive, you can take control of your healthcare experience. Remember, you are your own best advocate, and your health and well-being are worth fighting for. In the next segment, we'll discuss the importance of seeking support and building a strong network. Advocacy doesn't have to be a solo journey, and having a support system can make all the difference. Stay tuned and let's continue to empower ourselves on the journey to better health. Segment 5, seeking support and building a support network. Finally, let's talk about seeking support and building a network. Sometimes advocating for yourself can feel overwhelming, and that's okay. It's important to have a support system in place. Number 1, family and friends. Lean on your loved ones. They can provide emotional support, accompany you to appointments, and help advocate on your behalf. Number 2, patient advocates. Many hospitals and healthcare systems have patient advocates who can help you navigate your care, understand your rights, and ensure your concerns are addressed. Number 3, support groups. Joining support groups for your specific condition can connect you with others who share similar experiences. These communities can offer valuable advice and emotional support. Number 4, online resources. Utilize online resources and forums where you can share your experiences and get advice from others who have faced similar challenges. Number 5, therapists and counselors. If medical gaslighting has taken a toll on your mental health, consider speaking to a therapist or counselor. They can help you process your emotions and develop coping strategies. Building a strong support network can make a world of difference. It ensures you're not facing these challenges alone and reinforces that your health and well being are worth fighting for. And there you have it, folks. Medical gaslighting is a serious issue. But with the right knowledge and strategies, you can advocate for yourself and ensure your health concerns are taken seriously. Remember, your experiences and feelings are valid. Don't let anyone dismiss your reality. Before we wrap up, I want to encourage you to take action. If you've experienced medical gaslighting, share your story with someone you trust. Start documenting your symptoms today. Don't hesitate to seek a second opinion if you feel unheard. Also, consider joining a support group or reaching out to a patient advocate. Thank you so much for tuning in to this special episode of Energize Your Passion. If you find this episode helpful, please share it with your friends and family. Don't forget to subscribe to our podcast so you never miss an episode filled with positivity and empowerment. Let's keep the conversation going and support each other in our journeys to better health and well being. Stay positive, stay empowered, and as always, keep energizing your passion. This is Sunshine, signing off.